Hi, good evening everyone. In this video, I'll be talking about IUI, which is called as intrauterine insemination, which is a very common ART technique used or as a treatment for infertility patients. So, in this video, I'll be talking about intrauterine insemination technique, steps involved, the duration, the complications, cost of the procedure, and the result or success rates associated with IUI. IUI, intrauterine insemination, is a commonly used treatment modality for patients with infertility, offering them hope for conception. So in this IUI procedure, specially prepared and washed semen sample will be inseminated into the uterine cavity, which thereby helps in increasing the success rate of pregnancy. Let's talk about indications of IUI procedure. Number one, unexplained infertility. Number two, mild male factor infertility. Number three, cervical factor infertility. Number four, ovulatory disorders. Number five, endometriosis related diseases. Number six, any patient or a male patient having very low sperm count or zero sperm count, that is called as azoospermia, where donor sperm IUI can be done. So, what are the steps of IUI procedure? The IUI process involves several steps, so I will explain you one by one. The first step is ovulation induction. In this step, if the natural cycle of the woman is irregular, medicines or medications will be given to regulate the menstrual cycle and also to stimulate multiple oocyte development or multiple egg development in the ovary. Step number two, sperm preparation and collection. Sperm sample will be collected from the male partner. The sample will be washed and prepared to separate healthy moving sperms apart from other debris in the semen. Step number three is insemination. In this step, the prepared semen is then inseminated into the woman's womb or uterus using a small thin catheter at the time of ovulation. Step number four, post procedure monitoring and medication. After the IUI is done, the patient will be asked to take a brief duration of rest and then followed by medications, and also to come back for monitoring whether the IUI procedure is succeeded or not after 2 weeks of the IUI procedure. Now the cost of IUI in India. It usually depends on the hospital, the condition of the patient and the doctor. So in general, if you ask me, the cost of the IUI ranges in India between 5,000 rupees to 15,000 rupees. So this cost is usually for one cycle of IUI, and some patients may need multiple cycles of IUI, maybe ranging from 3 to 6 cycles of IUI. Complications of IUI or risks associated with IUI. Generally, IUI is considered as a very low risk procedure, or complications are less. However, there are few complications associated with IUI. So, the complications associated with IUI are multiple pregnancies or twin pregnancies, uterine infection. Number three, injury during the process or perforation of the uterus. Number four, and most important, is OHSS, that is ovarian hyperstimulation syndrome, because of use of drugs or medicines to grow multiple oocytes or multiple eggs needed for success of the IUI. Duration and success rate of IUI. So the duration depends on the patient condition itself. So the duration generally lasts for about 2 to 4 weeks, or sometimes in few patients we may need few months. And talking about success rate of IUI in India generally ranges from 10 to 20% of success rate, and many of patients may need multiple cycles of IUI ranging from 3 to 6 cycles to achieve the pregnancy. So, IUI provides hopeful option for couples struggling with infertility by increasing the likelihood of sperm reaching the egg. With its relatively simple procedure, moderate cost, and potential for success, IUI serves as a valuable tool in the journey towards parenthood for many individuals and couples in India. As with any medical procedures, it's crucial to consult with a qualified fertility specialist to determine if IUI is the right path based on individual circumstances.